Hi, thank you for tuning in to Global Elite Academy. Now we're going to talk about um, equal equivalent to IHSS in Las Vegas. IHSS is what is called in California and Colorado, and every state is called something different. Um, So let's see what it's called in Las Vegas. It's called Provider Flex. Is what it's called in Las Vegas. So after you get your license, your regular a license from the state, and it's called a personal care agency. So once you get your state license, then you're gonna go and apply to Medicaid for you're applying here for, and I'll give you the link and everything where to apply to Providers Flux. You can only apply online. They do not accept mail-in applications. So what you need to upload is your license that you received, operating, an agency, ownership documents, and the ID verification. All applications go through this portal, and I'll give you the portal, Providers Flux Enrollment Portal. I will give you that. Then you're going to choose the type of provider type that you're applying for. The first one, this is what is recommended, is provider type 30, which is a personal care agency. You will hire your caregivers, you will bill Medicaid, and this is how most, agencies operate. But they do have an option too, which is an advanced IHSS style. It's a provider type 83, and it's an intermediate service organization. It's more self-directed. Clients have more control. You want to do provider type 30. Then you're going to submit your enrollment and pass your screening. Nevada will run a background check on you, verify your license, and probably do a site visit. It says that it usually takes about 30 days after you have all the paperwork submitted. Then you're going to get your Medicaid provider number. Once you approve, you get a welcoming letter and contract. Now they have, I guess, some classes, and now you'll be able to take your Medicare class. I'm sorry. Now you'll be able to take Medicare clients, and you'll be able to bill them for service. And they probably will have some class to teach you how to do billing. They'll probably have that, teach you how to do billing for this, so that you'll know how to bill them. Usually Medicare have a portal that you'll go and submit your bills through the portal. So I'm sure it'll show you how to do that. Okay. So this is called a community-based programs, a Medicaid community-based provider. That's what you're going to be. That's going to be your official title, meaning you serve clients in their home. You get referred from Medicare case managers, hospital, and waiver programs. Okay. So that is how you sign up to be, a community-based agency that you will be able to take patients of low income that cannot afford to pay their own services, and they need help from the government to pay the services. This is not a Medicare program, but it is funded by Medicare. So with your license that you got from the state, you will now be able to take private patients and community-based patients, Medicare patients. Now, you still have to do marketing to get your patients. You have to do marketing for Medicare patients or for community-based program patients. You have to still do that. Some caseworkers, you'll be signed up, and some caseworkers will send you. They'll send you some patients, but you really have to sign up to all those places to get patients. Now, we can help you. We can help you with the SEO, with the marketing, so that you could get patients. A lot of people think all they do is sign up and they start getting a lot of patients. No, you're not the only. You're not the only place out there that's looking for patients. All these agencies are looking for patients. So when you first sign up, they usually put you on a list, and then you may get one or two referrals from the worker with patients. But you need to establish your own relationships with the workers so that they can send you a lot. Sometimes because you're new, you're just getting your certification, they'll send you a couple of patients because you're new, and then they won't send you anymore. So, because they have other agencies, they also have to send referrals to. So you have to build a rapport, and that's why it's good if you can possibly hire yourself a marketing person. So the marketing person can build this rapport, because that's all marketing is. Marketing is nothing but building relationships, so that you'll be able to get patients. Or you could do or, I'm not going to say or, you need to do some type of marketing in your company so that you can market your company to get patients. People think all they do is sign up and that's it, they're going to get a lot of patients. No, it doesn't work like that. If we help you, if my company helps you, with signing up or getting your license, or because we can help you getting your license, to either answering all the questions, help you getting your license, whatever we can help, get your policy and procedure manual, whatever we can help you do. We can help you do everything or one or two things, whatever you desire. But we can help you get your license. Now, when you go through us and we help you, then we also show you how to set up for private insurance companies like Blue Cross Blue Shield. How do you get their Medicare Advantage patients? We show you how to do that. Now, the thing about when you're getting the private insurance, you're not going on Medicare portal and billing for that service. So it's done differently. You're going to bill, if the insurance company is Blue Cross Blue Shield, then you'll go and bill Blue Cross Blue Shield directly on their portal. So how you bill these people is different. If it's a Medicare program, you would go through the Medicare portal and bill. But if it's not, then you go through the community-based program, and you just bill them for the service. Or some of this software, like what is the one? I think it's, I can't think of the name of it. But some of the software that they have out here, where the caregivers clock in and out and do their charting and all that, some of those places have a program on their software where you would just upload your billing and they'll submit it. And then some places don't have that. I know Access Care, they'll actually do your billing for you to the state. If there's any error or anything on there, they actually do it for you. We'll make sure everything going right and everything. So they'll do that. Because one thing with this Medicare billing, if it's not billed correctly, then If it's not billed correctly, you'll get all that. You'll get all. It won't pay. Like if you submit a claim and then the claim has an error on there, the whole thing is going to be denied and you have to put it back in. So this billing can be very tedious, but you can do it. They do have a class. They offer, a class where you can ask questions and do the billing. And then the software that you'll be getting, Axacare, whoever you'll be using for your software, they'll tell you what programs they provide. Some of them, I can't think of the one I was thinking about. Some of them, I have it, and you do the billing, and you just upload it, the billing in the software. So, and then I think it's Axacare. They'll do the billing for you for a percentage. I think they charge 3% of whatever the bill is. They get 3% of that to do your billing. So, yeah. Okay, so we can help you do whatever you need help from step by step doing everything, or we could just help you get your policy and procedure manual for your area. It depends on what you want us to do. So I'll write my information on this audio. I'll write down our website and our phone number where you could call if you need our help on anything, any of this. There is a fee. Clearly, it's not free if we're going to help you do the application process and everything. There is a fee. So, but we can help you. I just want you to know, if we're going to help you with the entire thing step by step, that means the training too. All of the training, all of the paperwork, just everything to get you set up and going with your home care agency and with the community-based agency. And we walk you through step by step and apply for everything for you. In Las Vegas, the price is different each state you're in because some states don't require you to be licensed and then some do. But in Las Vegas, they require you to be licensed. So we would get your license for the state, your regular non-medical home care license. We'll get that, and then we'll also get your certification for, or license, whatever you want to call it, for your community-based program. So both of this, so the whole program is $10,500. You could put half down and put, the rest of it, pay on monthly payments. Or you might not choose for us to do everything. You might say, well, look, I could do it. I just need a policy and procedure manual. That's fine. We could do your policy and procedure manual for whatever state you want it on. And the policy and procedure manual is going to run you $2,000. I'm sorry, it's $2,500. It's $2,500 for the policy and procedure manual. So we can, lower, depending upon what you want, we're not going to charge you for things that you don't need. We could charge you for things, just what you want. So if you need our help, like I said, our number will be included and our email, and you could just give us a call. Okay, thank you so much for tuning in. You definitely want to apply for this because, again, these are low income and they need help too. But I have a friend that owns an agency in Arizona, and for I'm not Arizona, for Colorado, I'm sorry. And for the IHSS program, which is the Medicare community-based program, he makes $25 million a year. You can make that too, but you have to sign up for the program. I notice that some people are signed up for the license and they don't sign up for IHSS. I think it's because a lot of people don't know about it. And so that's why they don't sign up for it. All right, then. Thank you so much for tuning in to Global Elite Academy. Have a good week. Bye-bye.